thank you for joining me today for this podcast. My first question to you today: why do some people become addicted while others don't?
Thank you, Nader, for inviting me. That is a great question to start with. Why do some people become addicted and others do not? The primary reason for that is genetics. So we now know that genetics has a large contribution to what people's brain circuitry is going to be like, how they're going to react to the environment. And of course, there are some environmental factors as well, which is the reason why it is hard to predict as to how severe the disease will be in someone, because it's dependent on a variety of factors. But we also try and emphasize that nobody really becomes addicted to something. They have addiction, and then it manifests in many different ways. So we use terms such as addiction involving alcohol as opposed to addicted to alcohol, or addiction involving opioids rather than addicted to opioids. Similarly, for addiction involving things other than substances, we say addiction involving relationships, or addiction involving gambling, or addiction involving food.
Okay, but what do you think about people who say addicts are people with weak character, they are bad people, they do bad things, and addiction is just a choice made by individuals who have low moral standard? What do you think about that?
Yes, that theory has been around for a long time, and there are a lot of people who think of addiction as a sin. People often refer to smoking as a vice, but that's a misunderstanding that has been there for many decades or centuries, where people dichotomize between somebody who's good and somebody who's bad. People dichotomize between good behavior and bad behavior, and there's a tendency in society to ascribe morality to something that someone considers bad. And especially if there's someone in authority who says this is a bad thing, then anybody doing that bad thing is immediately labeled as someone who is morally deficient or has a character flaw. So this is just the way of thinking that has been around for a long time. Of course, we know so much more about how the brain works and how the brain workings, or how the brain is working or not working, how it affects behavior. So scientifically speaking, a moral model just doesn't hold any water, but there still are a lot of people. Similarly, people who say it's a choice, they assume that everybody has the same brain capacity and everybody makes choices and they do everything by choice. And that's the perception that any of us can have, but in reality, a lot of our behavior is automatic. A lot of our thoughts and feelings, they are automatic because they are part of a pattern that is again influenced genetically, and it is influenced by whatever environment we live in and whatever life experiences we've had and how we have dealt with them. So I often say to people, life is not what happens to you, but life is what you do with what happens to you. So in that sense, it looks like a choice, but when I may choose something else or I react differently, which is not necessarily a choice, it's based on my genetics and experience, then my behavior is different than somebody else's. Of course, when it comes to addiction, since we know that addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry, that when those circuits connected with reward, motivation, memory, and some other circuits that the research is ongoing, they're involved, then the behavior is more automatic than choice driven.
Okay. So Dr. Hajela, what do you think about the self-medication model? Like some people believe, okay, they have insomnia, so they are using drugs to help them with the sleep, or they have depression, so they are using whatever substance to feel better, or they have PTSD and they're using some alcohol or drink at night to cope with painful thoughts or painful feeling. What do you think about this model?
Yes, this model is something that psychiatry has posited for many decades, and it's based on a concept which, in my opinion, is a little bit misguided. But it is because when people have certain symptoms, they are looking for relief from those symptoms. So people take something, and they think it's self-medication. But when you take a moment and think that whatever someone may be taking for relief, it feels like medication, but it really is not medication because it's not treating the underlying problem. So it gives people a little bit of symptom relief, and it's a common experience when you talk to people who have addiction involving alcohol, who do use alcohol to escape. Although they'll initially tell you that they're drinking to relief, to cope with life, or to self-medicate because they have insomnia or they have anxiety, but they will tell you, if you just probe a little bit more, that they actually get more anxiety when they are not drinking, which is part of the withdrawal, or they sleep even more poorly when they are drinking, even though they get the initial release. So in a common way, we often say that addiction is a disease of reward, relief, or escape. So when someone is taking something, thinking that they are medicating themselves, but rather than it being medication, it actually becomes part of the problem, which happens with prescribed medication as well, especially the two most common ones that people in today's society are very familiar with are benzodiazepines, drugs like Valium or Ativan, that are commonly used for treating anxiety, in my opinion, a little bit misguidedly, and also when people are prescribed pain medication, which people do need for pain, but it becomes very difficult if someone has pain and addiction to see and sort out as to how much it is being taken for actual pain relief and how much is just for escape. And it is a bigger conundrum because unfortunately opioids don't really get rid of the pain. They just take the person away from the experience of pain, which, if I have a lot of pain, which is a desirable thing, hence they are good medications, but in the presence of addiction, it is something that can get out of control.
Yeah, but how would I know if a patient is taking sleeping pills as an aid to sleep or abusing the pills as part of the addiction problem? Like, what would be, if there is certain criteria you're going to put to tell me this is addiction and this is an insomnia that need to be treated with benzodiazepines, or what would be, how I'm going to differentiate both?
Well, I would say to you that if you're just looking at the behavior, there's no way to tell. So you would not be able to tell on the basis of how much or how often somebody's taking it. And that is the reason why if someone presents with insomnia and they're taking medication or not taking medication, before embarking on either changing their medication or giving them more medication, it is important to explore as to what else is going on. Because insomnia is also a symptom. It's a symptom that something is interfering with the brain, normally calming down and shutting down at the end of the day when the person is going to be experiencing sleep. And most people who have insomnia, if you talk to them, they'll tell you that they have trouble falling asleep. Once they fall asleep, then they can sleep through. So this is a signal that the brain is trying to process a whole lot of information. So medication is one way to just shut the brain off in a very chemical way. But if you shut it off in a chemical way and you do it very occasionally, then it is not as harmful as if the person starts to do it every night. And if someone has addiction, this is where I've been emphasizing the addiction is a disease of the brain. So it is addiction that can drive people to take the medication more regularly and also escalate the dose, which again looks like a choice, but I hope you'll consider that it's not a choice because the impulsive behavior and compulsive behavior takes over. So it really requires the physician doing the prescribing to assess the patient in a holistic manner rather than trying to guess just by the pattern of behavior of taking the medication whether it's addictive or not.
Okay, Dr. Hajela, can we move to another point? What about people who say that addiction is just caused by disconnection from higher power or disconnection from your spirituality?
Well, that is also a very valid point, but it's not just that. Certainly, we define addiction as a biopsychosocial spiritual disease. So, disconnection from one's higher power or disconnection from the rest of the universe is actually a central feature in addiction. But in addition to that spiritual disconnection, there's also a social disconnection, there's a psychological thinking feeling problem, which is related to the biological circuitry, the brain circuitry not working right.
Okay, can you tell me more about the model you just mentioned, like biopsychosocial spiritual? What does it mean?
Yes, actually, that biopsychosocial spiritual idea is the second sentence in the definition of the disease of addiction. So the disease of disease of addiction is defined as a primary chronic disease of brain reward, motivation, memory, and related circuitry. And the second sentence of the definition says dysfunction in these circuits leads to characteristics, biological, psychological, social, and spiritual problems. So that's where biological problems are related to the circuitry, and then there are complications. Similarly, psychological problems, thinking and feeling problems are related to the circuitry, and then it creates more problems. So symptoms like anxiety or depression or shame and fear, anger, stress, frustration, all these things are related to the problems going on in the brain. And of course, there are social problems which are very commonly seen, easier to recognize, where people hang around with other people who are using drugs or engaging in addictive behaviors like gambling or video gaming or a few other things like shopping or even work excessively or continuing to work despite some negative consequences occurring in one's life, making that a priority rather than focusing on self-care. And certainly spiritual, which can be a causal thing initially, meaning because the brain's not working right, it is disconnected. But of course, as people engage more and more in addictive behaviors or using substances that affect the brain, then hopefully you can appreciate that complications occur in all four dimensions, which is bio, psychosocial, and spiritual.
Yeah, but you are talking about the complication is biopsychosocial spiritual, but I'm talking now about causes or roots. Is it spirituality, lack of spirituality, or disconnection from spirituality can be a risk factor or a cause for developing addiction?
Absolutely, yeah. Fundamentally, the spiritual disconnection, which is the person starts to feel isolated, they feel alone, and they don't have a sense of belonging in the universe. So this is a much more central point which goes beyond the psychological part or the psychology of feeling connected or not connected at a level of thinking and feeling. And of course, the idea of connectedness also involves social. So the idea of connectedness in that sense is social, spiritual, and psychological. But what I'm trying to emphasize is that connectedness is also influenced by the biology. So yes, these are all causal domains. So you can hypothesize that even if someone has a fairly healthy biology, but they have disconnection in the psychological, social, or spiritual spheres, then of course that will contribute to the disease of addiction. But from everything we know, the biology has such a huge effect on the development of the disease of addiction that is a big factor that needs to be taken into account. Because the reality of the situation is, if I have a healthy functioning biological system, then our biological system is actually designed to have healthy thinking and feeling response. And then that naturally leads to better social choices, which then includes having some sense of belonging in society and the rest of the universe, and have some meaning and purpose in life that are more driven by values and structure as opposed to disconnection.
Okay. My last question regarding the roots and the causes of addiction. What about people who think it is a biomedical problem? Like people start using drugs, using these drugs are gonna cause changes in the brain structure and the change in the brain function, and those changes gonna persist, and this is what causes addiction problem, and this is what causes complication, and this can affect the cognitive function or the emotional processing. What do you think?
Absolutely, what you're saying is absolutely correct. But in this story of just defining it biomedically, you're picking up the story at a later stage, meaning the person is already using drugs. And it operates on an assumption that there was no addiction and then exposure to drugs caused the addiction. When in reality, what I'm talking to you about, hopefully it makes sense to you, is that addiction is there in the first place. So absolutely, the drugs will cause more complications, and then there will be more overt manifestations. But what my hope is, and this is what I do with my patients, is to help them realize as to how deep-rooted the disease is. And as patients get better and they deal with the overt complications, and most patients will always say that, yes, I used alcohol with no problems until a certain point in my life, and then something happened and it got worse. But as they get better, they realize that it wasn't that they were not addicted and then they became addicted. They realize that the addiction that they thought happened is really the worsening of the disease as opposed to first manifestation of the disease. So as people get better, they realize the earlier and earlier manifestations of the disease, which is where people in recovery often say that I was born an alcoholic or born an addict, meaning they recognize at the level of their earliest memories. As one of my patients recently said, that he recognized that candy was something that he was seeking since as far back as he can remember. And then he remembers he got a new bike and he was just obsessed with the bike and riding the bike at the expense of anything else that was going on. Or video games came along and he was playing video games incessantly. So that's impulsive and compulsive behavior is hardwired in the brain. And as patients become familiar with what their life experience has been, what their physiological experience has been, they will tell you that they had this problem even before they first started using alcohol and drugs.
Yeah, I see. Thank you, Dr. Hajela, for answering all my questions. And I hope next episode we're going to go deep and go in details about causes and roots in addiction. Thank you.